Hello, I'm Tom Dozier. Welcome to this webinar on a new hypnotherapy treatment for misophonia called SRT. I am Tom Dozier. I'm the director of the Misophonia Treatment Institute and provide misophonia treatment and do research in the area of misophonia. And we also today have Chris Pearson, who developed the SRT treatment, and he is a hypnotherapist in Upton, West Yorkshire, the United Kingdom. So first, I'm going to present a little bit of an overview of misophonia, and then we're going to hear from Chris about the SRT treatment. So with misophonia, the way it is kind of generally defined is that a person experiences a trigger, often hears a trigger, and that stimulus elicits or causes an immediate reaction that starts with irritation or disgust and then just quickly escalates into extreme emotions of anger and hatred and rage and extreme disgust. Now, the trigger stimuli are generally commonly occurring soft sounds and some other visual triggers that I'll talk about. But the soft sounds, the most common is mouth sounds, chewing, lip smacking. Second to that is nasal sounds, sniffing, snorting, breathing. But really, a sound trigger can be any repeating sound. Consonants, typing, sound through the walls, birds chirping, equipment sounds, virtually any repeating sound can be a trigger. And there are also visual triggers are very common. Often it's motion associated with the trigger. So if crunching is a trigger, then jaw movement becomes a trigger. But it also includes repetitive motion such as hair twirling or leg shaking. Now, the popular view of misophonia is that the person hears the trigger and then has this extreme emotional reaction. It's perceived as involuntary. People try to avoid becoming upset, but they cannot. So it's an automatic reaction that's jerked out of the person. And along with this extreme emotion, there is a fight or flight response and general accompanying physiological effects such as muscle tension, increased heart rate, sweating, and general anxiety. So this figure shown here on the slide is that the person hears the trigger and then boom, there's this extreme emotion and a fight or flight response. And that's the typical view, the popular view of misophonia. Now, the prognosis for a person with misophonia is not good. We find that it generally gets progressively worse with time. The number of triggers, it starts with one or two or just a few, and it increases and increases. The severity of the emotional response generally increases with time, and it has a greater and greater impact on a person's life. For example, with a new love, the new love makes no triggers, but they get together, they get married, and after a while, the new love sounds start to cause triggers and creates a really difficult relationship issue. Just generally, triggers develop and increase with time. Misophonia can be debilitating, and right now there are no proven effective treatments that work for people in general across the board. The prevalence of misophonia, we find, I believe, that over 10% of adults will have misophonia or have misophonia type triggers. There was one study done with using university psychology undergraduate students, and they found that 20% of their volunteers, and these were blind volunteers, meaning they didn't know that it was a study about sound sensitivity, 20% had clinically significant misophonia. I believe that that's a little bit high because based on the population of psychology students, they're probably a little bit more neurotic than average. But I did a study a couple of years back where I had a random survey monkey survey, which is an online solicited, hey, take our survey and get 50 cents or $1 for your favorite charity. And so these individuals did not know what the study was about. I had 300 participants, And I found that 18% of the women and 12% of the men matched up to the ratings of my control group of people with misophonia who were on the internet support groups. So on average, I had 15% of those individuals with misophonia, and it was half men, half women. That was controlled in it. Now, what's the real misophonia? And the people with misophonia do not experience the real misophonia because in their perception, there's this trigger and this extreme response, but there's something in the middle that's imperceivable unless a person looks at it very carefully. And I find that with help, over 95% of the people that I work with can identify that there is a physical reflex, a muscle jerk that occurs directly caused by the trigger. So in these muscle jerks, it can be virtually any muscle on the body. Neck, shoulders, chest are very common, jaws, face and eyes, hands closed or open, legs, but any and combinations. And this reflex will occur to a very, very tiny trigger, and it's really the first thing that the person physically feels. There can be internal reflexes, stomach or intestine constriction, nausea, butterflies, esophagus constriction, sexual arousal, and I've even had cases with an urge to urinate. So this feeling comes directly from the trigger. I've had others that say there's something within their chest cavity. Another person described it as pulling a string out of their spine. So in this case, what I'm seeing is that the person hears the trigger and they feel it elicits a physical reflex, and these physical reflexes are controlled by our autonomic nervous system. So this drawing shows what I'm saying here. You hear the trigger and it elicits or jerks out of the person this physical reflex, and that physical jab elicits the extreme emotion and its accompanying tight muscles, fight or flight responses, and everything that goes with it. Now, I do believe that there is a secondary path that develops in some individuals where the trigger can directly cause the emotion, but it still contains that physical reflex in the vast majority, over 95% of the cases. If we look at the brain in very simple drawing here, our thinking brain is up on top, that's our cerebrum. Our emotion center is the limbic system, that's in the middle shown. And then at the bottom in the brainstem is our autonomic nervous system, that's our lizard brain. And our lizard brain controls our conditioned reflexes. And so that lizard brain perceives a trigger and jerks the person. And generally, no matter how many triggers the person has, it jerks the same muscle in that person. So one person, every trigger they hear, their hands jerk shut, make a fist. Another person, every trigger they hear, their shoulders pop up. So that's an autonomic nervous system. It's a Pavlovian conditioned reflex. Now, a little bit about diagnosing, how to know if you have misophonia or if you're a treatment provider that your patient has misophonia. Generally, patients self-diagnose from information on the internet. And the way to know if it's misophonia is that the individual will have an emotional response from a single instance of the trigger. And it doesn't matter if it's a low volume or high volume instance of the trigger. So for example, if a person gets real upset from dogs barking, and they have this extreme emotional response to dogs barking, yet when they hear a dog bark softly, it doesn't bother them, then that's probably not misophonia, because it's really the fact that the dog barking is really an irritating sound and very upsetting. So it's not misophonia if you're getting anger from an intrusive, irritating sound. Once again, prolonged traffic, construction noise, airplanes flying overhead, especially low flying, if you're on a flight path of an airport, or babies crying. These are generally annoying, upsetting sounds. But if you take one of those sounds and you make it soft, and short, and they still have a reaction, then it's misophonia by the way I diagnose it and define it. So treating misophonia, there's very limited treatments for misophonia, and they're being developed and worked on. The most common is probably an audiologist treatment where you have a hearing aid style sound generator. It's very expensive. You can also get much the same result with a lot of white noise or fans and noise in your world. There have been a couple of cases shown of cognitive behavior therapy that can help reduce the emotional upheaval and the dysfunction associated with misophonia, but it doesn't eliminate the initial physical reflex, and neither does the general audiologist treatment. There's neurofeedback, which is very expensive. It has some very well-known and publicized success stories, but there are many, many cases where people say it makes no difference. And there's a treatment that I developed, a counter-conditioning treatment called the neural repatterning technique. It has very limited applicability for specific triggers in specific situations, and so that's discussed in a couple of journal articles that I have written. And then there's hypnosis. Now, traditional hypnosis is known for providing no impact or benefit from misophonia or short-term benefit for misophonia. But Chris Pearson has developed the Sequent Repatterning technique and has some data to share with us today that shows that the Sequent Repatterning technique may prove to be one of our most beneficial treatments to date for misophonia. So thank you for listening to my part on this presentation about misophonia in general. And now we will hear from Chris Pearson, a licensed hypnotherapist in the UK who has treated quite a few individuals with misophonia. So Chris, I'll turn it over to you now.
Hello, my name is Chris Pearson. I'm a clinical hypnotherapist. Let's just begin by reflecting on the elements that together constitute misophonia: trigger, reflex, emotion. Without each of those elements, the component parts in place, the condition cannot exist. Without the links between them, the process cannot complete. Traditional therapy. Many earlier approaches have focused on the trigger. Many of those, most maybe, are applicable to sound triggers only. Some have made the assumption that the trigger elicits an emotional response directly. I recognised through empirical information at first that the condition misophonia is a three-step process of sense, learned physical reflex, and conscious emotion. My perception is congruent with Tom's theory, which I came across later. Hypnotherapy and NLP. Hypnotherapists working from an inappropriate model of misophonia have variously treated it as though it's a phobia or as a compulsion. In the development of SRT, Sequent Repatterning Therapy, we have first of all recognised how misophonia is structured, how its components are linked in the subconscious domain. Then we have explored the techniques already available that are appropriate to each element of the condition. So let's consider SRT. The trick here, if you like, is to use the very best techniques and to deliver their benefits in the right order, or sequence. Sequent means following logically or naturally, consequent, or characterized by continuous succession, consecutive. Misophonia is a pattern of behavior. And we are not seeking to simply remove that pattern of behaviour, to leave a dark void where once it was. No. We are putting in place a new, acceptable and beneficial pattern. The sequence. We begin by creating a foundation. We get to know each other and we find out as much as we can about your misophonia. That's not about misophonia as a condition, but about how it is for you as an individual. I also think it's important to begin therapy on that first meeting. So let's take a look now at that first session. After we've gathered some facts about you, we can talk about your feelings and your expectations. Then we begin with relaxation and establishing what I like to refer to as base camp. This is a safe place that you can return to if you're ever overwhelmed. It's always the first activity on an expedition, and this therapy is your journey towards a new chapter in your life. At this early stage, we can also begin using a process of anchoring beneficial resource states of mind and installing what some therapists call a calm switch. We then move on to emotional healing. This is an opportunity to let some of the pressure out, to release some of the emotion that ties you down to the experiences of the past and to unhelpful ways of thinking. Next, we begin to break the link between your physical reflex, the usually muscular reaction that the trigger causes, and your emotions. This is often common to all the triggers if there are more than one, so it's a very beneficial stage of the process to diminish the emotional feelings. The reflex. Next we deal with the physical reflex that occurs when a trigger is sensed. This happens at an unconscious level with no conscious thinking involved. We use a specific technique known as reframing to do this. We begin to bring the elements of the therapeutic process together now. The component parts have been sliced and the misophonia process has been diced. We can then begin to construct new behaviour expectations and new patterns based on updated current beliefs. Timing. The process that is SRT consists of 5 distinct steps. Each one has its place in the structure and each one must be delivered in a personalised form to each individual. The program is scheduled over 8 sessions, usually equating to about 8 hours spread over a couple of months. Sessions should not be more frequent than 5 days as a general rule, nor further apart than about 10 days. So weekly is almost ideal given that diary commitments fit a weekly schedule so much better. Where are we now? We have information on 31 individuals treated by me and anecdotal information on other clients through those therapists I supervise. That has allowed us, in collaboration with Misophonia Treatment Institute, to formalise Sequent Repatterning Therapy and to begin the next phase, which is to provide beneficial therapy and of course to record our results. 15 individuals were treated for persistent sound sensitivity issues during late 2013 and early to mid 2014. A summary of their treatment is shown on the slide. At that time, I was using the more usual SUD scale, familiar to many hypnotherapists. If we compare the severity of symptoms at the commencement of therapy with its conclusion, on this next slide, you will notice that in all but one case the SUD measure, which is subjective units of distress, that's significantly reduced as shown by the red bars. In the autumn of 2014, I began using the MAQ and other measures applied by Misophonia Treatment Institute in USA and other practitioners, including Scott Sessions and Marsha Johnson. This allows me to compare SRT more directly with other therapeutic processes. Early phase, autumn 2014. With the structure of SRT clearer, I began seeing clients in autumn 2014 planning to adopt the SRT strategy, assessing each new client using the Marsha Johnson measures applied by MTI. These sessions were mostly conducted online using Skype or mostly VC. The results of these consultations are shown here. This confirms that the 5 steps are covered in 5, 6, 7 or 8 sessions, usually at weekly intervals, and eliciting a significant improvement in each subject's responses to triggers over the period of the treatment. It is also worth mentioning here that amongst this group, those recording an MAQ score of less than 20 at its conclusion are no longer experiencing any significant triggering, and I'm eager to follow these individuals up in the longer term. The next slide shows that more graphically, with an average improvement of over 60%. Since then, and coming right up to date, I've seen 9 clients, of whom 8 are pursuing therapy, as shown here. You'll notice this again shows a wide range of individuals, but all having significant sensitivity as measured by the MAQ. It is becoming increasingly clear that working online is a very effective way to progress, and to all intents and purposes it seems as good as face-to-face sessions in the therapy room. We are also committed to ensuring that misophonia is better understood and that appropriate therapy becomes available to everyone for their personal benefit. If you would like to get in touch, please do. My email address is chris@chrispearson.co.uk, and there is a contact form on my website at www.chrispearson.co.uk. We are also in the process of developing the Sequent Repatterning Therapy website at www.sequenttherapy.com. Thank you. I'm Chris Pearson in Yorkshire, UK.
Okay, Chris, thank you very much. We look forward to hearing more from you as you get more experience and patient data collected, so that we can share the benefits of SRT with the world. Now, for you as viewers, if you have misophonia, we would ask you to ask your local hypnotherapist if they're interested in learning this technique. And if you're a hypnotherapist, we would love to share this technique with you and do some formal training so that we can make sure that individuals are treated in a consistent manner, if we're going to call this the Sequent Repatterning Technique treatment, so that we can get results that are validated from multiple treatment providers in multiple locations, which is one way of showing that a treatment really is effective, and it's not just the effect of Chris's office in the UK that's having this wonderful effect, or just the effect of his charming personality. So if you're interested, please contact us. My email is tom@misophoniatreatment.com. Chris, his email is chris@chrispearson.co.uk. So please feel free to contact either one of us. And please, especially if you have misophonia, contact your local hypnotherapist and see if you can get them interested in learning how to provide this treatment. So thank you very much, and we wish you all the best. Goodbye.